Welcome to this LEX18 Digital Conversation. I'm Davidson. October, of course, is Breast Cancer Awareness Month, and research shows the best way to prevent and detect early stages of breast cancer, routine breast exams, and mammograms. But there is a technology now available that will help aid doctors in seeing potential cancer of the breast clearer and earlier. Joining me is Kim Davis with Patient Choice Ultrasound and Thermography. Always good to see you.
Great to see you, Dia. Thanks for having me.
All right, let's talk a little bit about this because this is huge. If we can kind of get people in and get them to check their breasts, survival rates go right up through the roof, don't they?
They really do. And the interesting thing about thermography, believe it or not, it's been around since 400 BC.
Huh.
Hippocrates actually would pack patients in mud, and wherever it would dry first would be where the disease was, because your body emits a natural radiation. When you have a fever,
right?
You
get hot, right?
When you sprain something, it gets hot.
Yeah.
And so what thermography does is that it is the camera, a very sophisticated camera with computer analysis, can detect what your body is emitting. And so it's like a unique thumbprint. And at Patient Choice, we recently just upgraded our equipment to the state of the art, which is 4 times and 400% better resolution than older machines. So we're real excited about introducing that.
Wow. Well, let's talk a little bit about it, because everybody knows mammogram. We hear that word. You know, our doctors tell us to go and get that done if we, I guess, are this right age or the right, potential for it or family history for it. Are they the same? Is this a choice I can make and say, oh no, I'll do thermography instead of mammogram, or is it something that you got to do kind of parallel together?
Well, you know, at Patient Choice, we're not physicians, and our job, we feel like, is to educate people in all what's in the toolbox.
Sure.
They're completely different types of studies. You wouldn't use, a hammer's not a screwdriver, screwdriver is not a saw.
Right.
Sometimes you need all of the tools, sometimes you only need 1 or 2.
Wow.
Structural tests, which the gold standard is still mammography, is a structural test along with an MRI and an ultrasound.
Sure.
Those structures are looking at the physiology or the actual anatomy of the body, and they can detect when something has already developed.
Right.
Thermography is not structural at all. It's a metabolic test that is based on your infrared detection of what's going on. So it is like a fingerprint or a thumbprint that's unique to you that never really changes unless you have disease developing or inflammation going on.
Right.
So it's almost like it's like a warning sign that your body's kind of crying for help.
So is this something that you need to kind of have sort of a baseline one done, and then?
Well, there's different schools of thought on that. Basically, the physicians that we're involved with, who've been doing research for over 25 years, are board certified thermologists that read it. They say, if you are normal, the day that you are normal, then you come back annually for your risk assessment.
Right.
You don't need to. Normal's normal. You wouldn't go back to your doctor next week to see if his normal exam was normal again.
Right.
Some other schools of thought disagree. If you have what they're rated in, there's a rating system for them. If you have what they call equivocal, which is a TH3, then they recommend that you come back within 6 months to see if it's an inflammation or if it's something's going on that may be preventable. Estrogen dominance is one of the things that's really highly detectable through thermography.
Why is that?
Well, it's because of the way estrogen reacts in the breast, which is one of the earliest detections or risk factors for cancer. And thermography is one of the best ways to see that. And so a lot of times if we can detect that early, before there's disease, and if you can modify that with your physician's guidance, maybe change your diet or change your hormones or whatever,
maybe
assess
it,
it could be a way of changing that course. So it is it's a single factor of your own, more so than even your family history or whatever, because it's about you specifically.
Okay, kind of describe for everyone, those of us who've had mammograms, we know that it's hold your breath, pinch, it's like it's in one of those kind of C-screw kind of things, and it's a torture machine.
It's uncomfortable.
It hurts,
and at Patient Choice, we are not we're not anti-mammogram.
Right.
In fact, we are pro-structural testing.
Right.
But we're not trying to shame those women who choose not to do it,
Right.
and we're not trying to radiation scare those who choose to stay away from it.
Right.
Either one, it is your choice, but understanding that without it, you're not getting a complete package. But for thermography, the nice thing is it never touches you.
Oh.
You do have to acclimate to the room because you want to make sure
body temperature wise.
Body temperature wise for about 15 minutes. So you come into our office, which we control. We have monitors in our room that keep it at a very specific temperature.
Right.
We actually take your temperature because if you're running a temperature that day, we want to make sure that you're not sick and don't know it.
And everybody's normal temperature is not the same, right?
Right, but we also want to make sure there's not anything underlying that may be elevating what's going on. So we record all of that information. You disrobe from the waist up, and we keep it very private in the room.
Sure.
And then once you've acclimated, it takes about 15 minutes. Then we take a series of standardized testing or images, photographs. You never get touched, and then we send those off to be interpreted.
Oh, wow.
And we actually now send you back home with your own disc and things while you're waiting on that. So
good, because I was going to ask, how do you get it to your physician for them to be able to?
Well, thank goodness for the cloud these days, and so because our physicians are out west, and so we send them to actually we're using Dr. Amalu, but we send those to them, and as soon as they get read, which takes about 7 to 10 days because they read internationally, and then we get the report, then we give them back to you and then he suggests whatever follow-ups that may or may not be.
And then you have something that you can carry to your home physician.
Exactly.
Or what have you. Wow. Well, about how long is the whole process from start to finish?
Well, because of the acclimation, we usually recommend you're there about 30 minutes, 30 to 40 minutes to go through that. And it's about an annual screening if you're within the normal limit range. If they find something, they'll suggest about a follow-up in 6 months to make sure which direction that's going for. And it's not just for breasts, there's full body. And I hope to have have you back at a different time. We're looking at things for like wound care, diabetes, oral care. There's a lot of stuff thermography is really good for, but we're focusing on breast since it's
breast cancer awareness. But now, when we think of breast cancer, we think of women. But there are many men. I mean, Beyonce Knowles' father is coming out now saying that he is dealing with breast cancer as a man. And that's huge for men to kind of be transparent and say that. Would this be something that you think maybe would be a good option for men?
I think it could be very much so because it's very hard to get a mammogram on a male.
Right.
I do ultrasounds. We do ultrasounds in the office as well, and I've done quite a few ultrasounds in my career for male breast disease because it's much more accessible to the tissue because you're not trying to put them between those plates and get that tissue through there. But it is. I think I forget it's like maybe 5% male get breast cancer. So it is a disease that affects everybody, but highly, like 1 in 8 women in America still get breast cancer. So it's something that we have to take very good care. And the papers state today that if you combined a structural test such as mammography with thermography, which your survival rate is like 95% in catching it early and getting it done. So the two combined are a really good package than either one of them alone.
For someone to consider, definitely, if they know that they have a family predisposition for.
But even without 75%, I think it is, people with breast cancer have no family history.
History at all. Wow. But if you say have been diagnosed and treated, this might be something that you might want to consider after that.
Yeah, absolutely.
As a way to kind of follow
a risk assessment as you go on. And it's really, again, younger women under 40, because there's a high risk of women that get cancer under 40. Women with that have augmented breast, really struggle with.
I was going to ask you, can you still see through?
Well, we're not really seeing structure. We're seeing your skin. So it's whatever's going on at the skin level. Is what's going on. So it really isn't affected by implants or anything like that.
Really?
Yeah, which is a huge advantage to thermography.
Without a doubt, because I'm guessing that with traditional mammography, there would be a little bit of...
Well, it's definitely more discomfort. And there's always the risk of rupture, which they worry about. I mean, it happens, but it doesn't happen frequently, but it happens.
What about dense breasts?
Dense breast, again, it's skin level, so it's not a problem. And then, again, the ultrasound is excellent for dense breast.
Right.
But, you know, again, mammography, you know, we don't provide mammography. We're going to get a lot of phone calls, but we don't provide that. But it is still considered the gold standard.
Right.
So, you know, I feel obliged to put the truth out there that it is. It's controversial like everything else. If there was one for sure test, we would only do one test. There isn't. And so, you know, these are all the tools in the toolbox. Do you need them all? Does everyone need them all? That's between you and your physician. I feel that my job is to be honest with integrity. I don't even sell, you know, provide all of these things, but you know, to put them out there for people to make the decisions for themselves with their physicians of what's best for them. But, you know, there's a lot of good information, and combining, I'm high risk, so I use all the tools in my tool chest, all of them. You know, I do a mammogram, I do an ultrasound, I do a thermogram, because those things are very important. I have not done an MRI yet, but and that may come down the road.
But what do they say? Knowledge is power, right?
Knowledge is power, and early detection saves lives, and so
that's the bottom line.
It is, and so you know again the mammograms, they're uncomfortable, but you know radiation and chemo is not a walk in the park. It really isn't.
A lot of insurances cover though mammograms. How about with thermography?
No insurance covers it, but if you go to our website, there is a place that they can call and get help if you can't afford a thermogram. And I know like AFLAC and stuff will often do one a year and put towards that, and we usually will accept whatever
comes back from that.
Comes from that, because we just want to help, you know, with healthcare and help women.
What's your website?
It's www.patientchoiceultrasound.com.
There you go. That's easy to remember.
Yeah.
Always good to see you, Kim. Always good to see you guys out there. Thanks so much for watching this LEX18 Digital Conversation. For more, just log on to our website. That's lex18.com. Until next time, I'm Dia Davidson.